I was at the doctor's office, and you have to take your vitals, and I have to take your vitals and everything. Anyway, the young lady that was taking my vitals, after I was seeing my blood pressure results, my diastolic number was low than usual. So I asked her, is that normal? And then at first I asked her also, remind me what the diastolic is. And she couldn't tell me. She asked, sweet girl, very nice. But she actually was like, oh, I can't remember. And I looked at her and I was like, you can't remember? And I felt like saying, bitch, that's like textbook 101 when you went to school for this. I mean, come on. So I'm sitting there thinking, I'm telling her, okay, just let me remember what diastolic is, and I'm trying to. She's like, oh, well, you can ask the PA when you see them, when you see her. I'm like I just had to stare blank. And then I looked at her and I was like, well, hold on. I said, the diastolic is the pressure of the arteries. When the heart beats, the pressure of the arteries when the heart beats, beat rests between beats. That's when the time when the heart is filled with blood to get oxygen, I told her. She's like, oh, and I'm like, I said, yeah, it took me a while because I try to educate myself, especially when, 20 years of high blood pressure and popping medication for it, but I kept looking at her out of concern. How can you not know this? It's a simple textbook question I'm asking you. I shouldn't have known it. There's a lot of patients that doesn't know. But the fact that I asked you and you taking vitals, she wasn't a CNA. She was the title was patient care associate or something, And this is the same person that had taken my EKG. So I was a little concerned. I mean, are you going to put it in the right spots of the, it could give off a weird reading. I mean, I was just like, well, I hope she puts the wires in the right place, because this woman, that if you went to training and got certification, license, or whatever it is, to do vitals, and let's say it was a red flag in my vitals, you should be trained and educated enough to be able to say, let me talk to the nurse practitioner about your reading, because there's a concern or whatever. The fact that you didn't know about the diastolic and what does it do, and it took me a while to think about it, and then I explained it to her, which, whatever, it's like stupid. Anyway, that kind of bothered me. But again, very nice young lady, very sweet, very patient, and she explained everything that she was doing when I was with her. It's just that little part had me a little worried that she wasn't able to say, oh, diastolic is X, Y, and Z. And I had to sit there, break my brain, and trying to remember. And then I explained it to her, and she's like, oh yeah, you know. I felt like saying, no, bitch, you should have known. Anyway, it's just things during the day sometimes entertains you and boggles your mind. Hope everyone's having a good day. Bye. Be blessed.